Hi, good morning, guys. Good evening. Can you hear me?
Yes, sir, we can hear you.
Hi. There's something I want to see if I can hear. Hello? Yeah, can you hear me?
Yes, sir, we can hear you.
Okay, fantastic. So it's 5 o'clock, so we'll start the talk. So today's is actually a different talk from what we normally do. Today we're going to try and talk to youngsters about the importance of CV. So how to apply for jobs. It's not just for international jobs, but even for local jobs as well. So I think it's quite important that you understand what is the process that happens when you're looking for a job, and how are we gauging you. So I sit on the other side of the table quite a lot, so I can actually give you an input into how we do things. So let me start sharing my screen first. So can you see my screen now?
Yes, sir, we can.
Okay, fantastic. So a lot of you, some of you may already be in a dream position and happy with life. A lot of you are looking for the best position in life, and a lot of you are looking at how to progress in your career. And so today's talk is designed to address that question: to how does one progress in one's career? How does one make sure that you're noticed in the crowd? And that is the whole key. So today, as we talk, most of you probably would have already got a CV done. Okay, I'm pretty certain almost everybody. Is there anybody who doesn't have a CV in this group? So no. So everybody has made the CV, and then you go into the various areas, into journals or websites, and then you read the applications. Then you apply for these jobs. But the problem is you don't get shortlisted. You think your CV is excellent. You think you are the best guy out there. And no doubt that you are the best guy. But the problem is you're not getting noticed. And the problem is you cannot figure out why are you not getting shortlisted. That is the main problem. So a lot of people don't understand, why am I not getting shortlisted? Yeah, somebody's raised hand. Apu Saha, you raised hand. Is there something you want to say? Okay. So a lot of people cannot figure out why they're not getting shortlisted. And I am today going to talk to you from the other side of the table as the person who actually writes the application and who makes the design of the job profile. And I'll tell you the secrets of why I pick people. I'll tell you the secrets of why I would think you are the right person for my job. Okay. So the first thing that we're going to talk about today is job applications. We're going to look at job applications, see where are they available. I'm then going to talk to you about how do I, on the other side, sit and I shortlist people. Okay, so you need to understand this process very clearly. A lot of people don't understand how do people shortlist. And then we will talk about how to prepare a CV. So a CV is not the first point of preparation. When you're looking for a better job or a brighter job or a bigger position than what you are, the first thing is not to prepare the CV. The first thing is to understand the requirements of the job. There are only two questions that have to be answered in a CV. One, the first question is, how does this job suit me? Which means, what is this job bringing to me? And the second question is, what do I bring to the job? And when these two questions match, when A matches B, is the time when you get shortlisted. So the reality is, if you have a generic CV prepared, which you prepared 10 years ago, and you're still using the same CV and sending it for every job application, then the chances are that there are 200 people like you who are doing exactly the same. And I have got only half an hour of a busy day to shortlist 200 people down to 5. So 195 CVs I'm going to dump into the bin. So I'm looking for reasons to dump the CV into the bin. Okay. And today I'll share with you what are the things that I look for when I'm dumping a CV into the bin. Because I want a shortlist out of 200 down to 10. So really you need to understand what are the mistakes that you're making and what are the reasons why you are not getting shortlisted for jobs. And the reason is because you're doing it completely the opposite. You're actually making your CV first and then reading the job application. And the whole process does not start like that. Okay. So first, let's look at job applications. Let's look at jobs that are available around the world and where are they advertised and things like that. So if you are looking for a job in UK, US, or Australia, then the standard jobs which are coming in the field, depending upon your level of experience, is either a junior clinical fellow or a senior clinical fellow. And in our understanding of a junior and a senior clinical fellow, when we advertise these positions as a junior and a senior clinical fellow, a junior clinical fellow is usually somebody who has done a few years of a senior house officer job in the specialty. Okay. So I need you to have some experience of the specialty, but I don't need you to be operatively independent. I don't need you to be, a flying operator, because the whole idea of a junior clinical fellow is I'm going to teach you everything. But I need you to also fulfill my service commitments, because I have, besides teaching program, I also want to make sure that I'm running the hospital and my patients are being cared for. So I want a person who will be there to look after my patients. So junior clinical fellows are traditionally a slightly more younger profile. I want somebody who will look after my patient, who will do the on-calls. And if he doesn't know any operating, I'm okay with that. Okay. A senior clinical fellow is usually a person who's like a registrar or maybe a senior registrar, depending upon which unit you're going to. And a senior clinical fellow is somebody who knows the subject for a little while and can do some operating, which means that he will actually run my list for me. That is what I'm looking for. When I'm looking for a senior clinical fellow, I want somebody who will do bread and butter stuff. If it's a that's pleural biopsy, I don't want to stand opposite him and, be hassled by that. He should be able to do some of the basic bread and butter stuff. And then all the advanced stuff, I can teach him. That's not a problem. So the difference between the two is very clear in my mind when I'm shortlisting. So you have to identify what are you or at what level are you. And also you got to remember that you may be experienced in one country, but when you go to another country or a totally new system, then you may be required to actually step down from your role. So, if you are a senior registrar in your country, please do not expect that we will take you into a senior registrar position in UK, US, or Australia. Usually, we want you to take a step back, enter into the system. We want you to understand the system before we let you loose onto the operative scene. So as surgeons, we all want to operate, but we have to be careful that we select the correct person for that. Then the other positions that are available are specialty fellowships. We have international fellowships for robotic surgery, international fellowships for VATS. We have international fellowship for tracheal surgery, international fellowship for transplants. This is in the thoracic domain. On the cardiac domain, you have international fellowships for mitral valve repairs, aortic surgery, heart transplant, and things like that. And those are actually designed as a super specialty fellowships. So in that position, when I want to pick up a guy for a specialty fellowship, I want him to be competent in the subject, which means I expect you to be an independent operator. Okay, I expect you to be able to do a routine CABG, a routine aortic valve. I expect you to know how to do an ASD, VSD. In the thoracic world, I expect you to know how to do a VATS lobectomy, open lobectomy, and a little bit of VATS. So these three levels are different. So the first level is I want you for service requirement. The second level is I want you to be operating for me so that my life becomes easier. And the third one is at a very advanced. I want you to be a fully independent surgeon in your specialty, but because my unit does something advanced like transplant or like robotics, I am happy to have you with me, and you will scrub for all my specialty cases. And that's how I look at it. And then, of course, consultant level is a different ball game altogether. Consultant level, usually these ads, when they come out because there is a service requirement. So sometimes, like in the NHS, we want to provide a service, and we need 3 or 4 consultants all at one go, and we don't have enough qualified or trained people within the country. Then we will advertise for a consultant, for an overseas consultant. But these advertisements are very few and very far in between. And for you to get into a consultant job, you've got to prove that you really bring value to us. And so consultant jobs are not that commonly advertised. But keep looking for them. They do come, and you never know, particularly with Brexit happening and with a lot of people leaving the UK and things like that. There are a lot of job vacancies coming up within the NHS and within Australian system as well, where they are falling short of consultants. So service requirements do demand that we allow overseas people to apply for this. So that's one. The second thing, if you're looking for jobs in the Middle East, then it's a different ballgame. In Middle East, it's all of it is all service commitments. There are no training positions usually in the Middle East. You go there because you want to earn a bit of money and you want to do some decent work. And so the levels that are available is as a specialist, as a consultant, as a senior consultant, or as a chief consultant or director. And all of these have very, very dedicated, very specific requirements at each level. And you need to match these levels. Don't think that a specialist means you're going as a specialist thoracic surgery. Specialist is actually the position below a consultant. So be very careful when you apply for these, because in the Middle East, once you enter the system at one level, it is very difficult to rise through the system to the next level and the next level. And they have got very clear-cut guidelines. So, they say postgraduate degree, and 3 years postgraduate degree, you will you qualify for specialist. 4 years or 5 years, you qualify for a consultant. 7 years, senior consultant, and 10 years and above, you qualify as a chief consultant or a director. And the packages are the remuneration is sequentially much higher once you get into each one of these levels. And so that's why it's very important that do not mistakenly under apply. If you are very qualified and you've got the right things, do not apply for a specialist position when you actually can qualify for a senior consultant, for the simple reason that your salary will be severely affected if you go for a lower position, and then to rise through the system becomes very difficult. So this is something that we've seen over the years, and because I deal with these situations, I understand. So now there are many websites where you can look for these ads. A lot of people ask me, how do I know? I never knew there was a job application and all that. Most people in India and Southeast Asia, they miss a lot of opportunities because they do not put in an application. The rules are very clear here because it is we are employing somebody, so we are governed by the Department of Employment and Work and Pensions, and we have to be very careful about the legal process of hiring somebody. And the first and foremost legal process is that you need to have applied for the job. 99% of people don't even realize there is a job out there available for them. So they don't even read the correct websites, and they don't know that jobs are available out there. So in the UK, if you're looking for jobs, my advice would be to look at jobs.nhs.uk, or you can look at jobs.scot.nhs.uk. So this is Scotland, the second one, and the top one is for UK. Usually England jobs come on this website. Track jobs is a very good one. Track jobs, what you can do in track jobs or in any of these websites is you go in there and you make a profile for yourself. When you make a profile for yourself, you must fill in the requirements that you're looking for. So whether you're looking for a senior clinical fellow, junior clinical fellow, which specialty, cardiothoracic, cardiac, thoracic, transplant, whatever. And the good thing about these jobs, about these websites is that once they have your profile on their system, then whenever a matching job comes up, they will send you an email. So because I am on these uh, websites like for 20 years or so, even now I can get sometimes a advertisement come to me for a registrar in thoracic surgery because I had maybe applied 20, 25 years ago. So you must keep your profile on these websites. And the best one is BMJ Classified. So BMJ Classified, in my days, it used to be BMJ Classifieds, but now you have all these other websites. And the good thing about these websites is that when you upload, you don't have to upload a CV. It actually asks you to fill a separate form for each job. And so when you fill a separate form for each job, you have to it creates a profile and it saves it so that the next time you apply for another job, you don't really have to type everything back in again. And most of the time, if you've made a CV according to the needs of the jobs overseas, you will be able to cut and paste from your CV into the various columns that are available on these websites. And so your profile is ready. The first time is always very difficult. It takes a long time to fill in one application. Sometimes it can take you 3, 4, 5 hours to fill in one application. But the first time when you've done the first application, after that, it is a piece of cake because you just use that profile and send it for the next job. So don't think that just having made a CV, you can upload a PDF and that works. Nowadays, that doesn't work because each job comes with its own requirements and you need to prove that you are fulfilling those requirements. Okay. So some other websites that you can look for in the UK are nivu.co.uk. If you're looking for Gulf, then look for MNC Jobs Gulf, or you can look at read.co.uk. Now, the Gulf jobs, if you're looking for jobs in the Gulf, then type in jobs in the Gulf, and many private recruitment companies and HR companies have their own websites. So you can, once you upload to one, they usually share data. But every time it's in another country, you might have to upload it again for that country. So there are various countries, Abu Dhabi, Dubai, Saudi. So you got to decide where you want to apply, and accordingly, recruitment agencies are specialists for specialist countries. So you decide on that, and then you can work on that. So let's look at the advertisement. Okay, whenever I'm talking about UK. Okay, and if you can fulfill the UK criteria, the same job, the same CV can actually work for US, can also work for Australia. Okay, so I'm talking about Europe, US, and Australia, and UK. So whenever a job comes in, there are two things that you have to look in the job advertisement. Okay, the first one is essential criteria, and the second one is desirable criteria. These are two completely separate things. So one is called as an essential criteria, and the second one is called as desirable criteria. And you must read the job application to understand what is the essential criteria and to understand what is the desirable criteria. Every job changes. Every job has a different essential and a different desirable criteria. So do not send a generic CV to all applications. You will never get shortlisted. I'll tell you, 190 people out of 200 do that, and 190 CVs out of 200 land up in the bin. They are just wasting their paper, their time, and effort. So if you cannot match yourself to the essential and desirable criteria, there is not a hope in hell that I will shortlist you. Okay. So the first thing when I have a pile of 200 CVs on my table and I glance through them really quickly, it is very easy for me to pick up the CVs which are at least tried to match the essential and desirable criteria. It's very important to understand this essential and desirable criteria. And I'm going to go into each of these in a bit more detail. Okay. Is it making sense what I'm saying, guys? Are you happy with the way I'm going, or do you want me to slow down?
No, sir, it's great.
Yes, sir.
Is it going okay? All right. So now,
Okay, sir.
first, let's look at the essential criteria. Okay. Whenever we put out an application, there's a legal requirement for me set out by the GMC and the Ministry of Health, and I have to fulfill these legal requirements. And most of the times, the legal requirements are what feature in an essential criteria for a job. Okay. So the first, of course, is qualification. you need to have a certain level of qualification. I mean, you cannot be a dentist and apply for a maxillofacial job under me. So I need you to be qualified as a dentist and a doctor. You understand that? Or you cannot be an Ayurveda specialist with a Ayurvedic degree and apply for an SHO job in general surgery. That will not work. So the legal requirement is very clear cut. The qualification is very, very important. So that's the first qualification, which actually enables you to get registered with the medical council. So the qualification that we are looking at is a qualification which is recognized by the General Medical Council UK. So if your university is not recognized by the GMC, you have to, the GMC is the main body. You have to go to a website called as gmc-uk.org. Okay, so gmc-uk.org, and you must fill in the name of your university, because nowadays we have a lot of private medical colleges and a lot of medical colleges which have changed their names. A classical example is the Madras Medical College. Somewhere along the way, they changed the name to MGR University. And I remember during my time, the change had happened in the 90s or something. And a lot of people who were fully qualified MCH cardiothoracic surgery applying for registration with the GMC were rejected because the name MGR University was not in the GMC register. So before you start any of these process, you must make sure that your university's correct name is registered. Okay, it is vitally important, because if that's not there, then you have to start at a much basic process. You have to make sure that you write to the GMC and you make sure that they know the name of your university. So the first essential criteria is qualification, and qualification usually is MBBS. That's the first criteria. We look for MBBS, MS, MCH. These are the standard ones that we look for. So basic qualification has to be there. If it's a junior clinical fellow, I don't need you to be more than an MS. I'm quite happy if you are an MS with a little bit of experience in cardiothoracic surgery. So it doesn't mean that you should have done MCH to get these jobs. That's not true. So the qualification decides what is the level of the entry into the system. The second thing that we look for, and it is mandatory part of the essential criteria, is fitness to practice. And the fitness to practice means that your medical council should at some stage be able to give a no objection certificate, which means that you do not have any malpractice suits or any complaints, malpractice complaints against you in the last 5 years. Okay, so that is another important thing. So fitness to practice is very important. And so the reason why I'm laying this out is when you prepare your CV, these things should be highlighted to me right at the start, so that I don't put your CV in the dump straight away, saying that you don't fulfill the essential criteria. You understand that? So very, very quickly, you must be able to tell me on the very first page, very first paragraph, that you are A, qualified, and B, you have fitness to practice. Okay, you're not somebody whom I will spend the whole process of interviewing and giving you the job, and then I will find that actually your medical council has not given you an NOC. So very early, you must be able to fulfill this. The next thing that's important in an essential criteria is language skills. So you must be proficient in English. If you were European, you didn't have to prove your proficiency, but now with Brexit, even Europeans will have to prove their proficiency from January 2021. And I would suggest anybody who's starting to look at applying for jobs overseas, do not waste time doing the IELTS. Okay, it is absolutely mandatory. You must pass the IELTS. So even before you start applying, because when I see a CV which says IELTS 8.5, I keep the CV. If I see a CV which does not say IELTS 8.5 or 7.5, I am hesitant to keep the CV, because I don't know whether his language skills, will he pass the language skills or not. So very early in the CV, I want you to tell me that you have passed the proficiency for the language skills. Okay, so very important. Language skills is needed. IELTS is a requirement, across these countries that I told you, we need you to be able to speak good English, because at the end of the day, you are going to go out there and talk to our patients. And if you cannot communicate with our patients, then you are a danger to the healthcare, and we don't want you. So that's the other thing. The other thing that a lot of people don't focus upon, and they don't keep it ready even before applying, is their occupational clearance. And the occupational clearance is not something that we look for shortlisting, but occupation clearance is something we look for before we offer you the job. So when we shortlist and we get you into the interview, we don't look for occupational clearance. But if you have already mentioned somewhere in your CV, it's a plus point. It will mean that I don't have to, I don't have a problem. I will not waste all my time of interviewing you and then find that you were a hepatitis B positive. Yeah. So occupation clearance, we are looking for 5 or 6 things. Every hospital has their different occupation clearance, but you must get at least a few basic ones done. And the basic ones that we are looking for is hepatitis B, hepatitis C, HIV status. We are looking for MMR. We are looking for rubella. We are looking for BCG status. And we're looking for tuberculosis exposure. Okay, so these are 5 or 6 things which actually are really important, and they do matter to us. And if you've already got a certificate saying you are occupational health cleared for doing blood bone procedures, then it's a plus point for me in surgery. It doesn't matter if you're going to do medicine or if you're going to do some pathology or something like that. But if you're applying for a surgical job, I want you to be occupational health cleared for blood bone procedures. That's the certificate that we get, and all of us have it. Each one of us, we carry these certificates with us. And in fact, in the UK, we all have a smart card. Okay, and in the smart card, all our occupational health certificates over the years, the vaccines that we've had, the hepatitis B vaccines, the booster doses, the MMR vaccines, the rubella, and all that is actually there on the smart card. And all I have to do is they have to just put a laser on the smart card and they will get all the clearance. So it is very important. This is an essential criteria. This is not a desirable. You have to. We will not employ you if you've got tuberculosis. We will not employ you if you've got hepatitis B positive. We will not employ you if you're hepatitis C positive, and we will not employ you if you are HIV positive. That's the bottom line. That is the reality. And in surgical fields, we want all of this to be cleared even before you start applying to us. Okay, it's absolutely mandatory. The next thing which we want to do in essential criteria is to see career progression. So I don't want somebody who has been at the same position for last 20 years, okay, and apply. No, you have to have done MBBS. You have to have done MS after that. You have to have done, an SHO job. You've got to have become a registrar. You got to have, you must show that you are rising in your profession. Okay, that is essential criteria. It's not even a, desirable. It's an essential criteria. You must show career progression, and most importantly, gaps. If you've got gaps in your career progression, they have to be explained. We are actually very happy if you have done something alternative, like if you have taken 1 year out to compete in cricket in IPL. That is a huge plus point. So extracurricular activities, sports, social activities. I traveled to a third world country to do volunteer work. Huge plus point. That is actually undesirable. I'll show you undesirable. So that is a huge plus point. So we don't mind gaps. We absolutely do not mind gaps in career progression. But we want you to explain what you were doing in gaps. Okay? And in females, you are perfectly all right to say, I took a gap to take care of my children. We never penalize you for taking a gap for family reasons. Even males can take a gap for family reasons as long as you can give a good explanation of that gap. I mean, my spouse passed away. I had to look after my child for 3 years. Doesn't mean you cannot become a cardiothoracic surgeon. We are actually very sympathetic to that. But gaps have to be explained. And that is the important thing in essential criteria. Okay? All right. Now, the next essential criteria is clinical skills. We want to know clinical skills. Now, I promise you, I have spent years and years in this job, and I've appointed a lot of people to positions. And I promise you, I have met maybe 5 or 6 people who genuinely have a logbook. And more importantly, I've met only 5 or 6 people who genuinely fill in the logbooks every week or every month. 99% of people fake their logbooks, or they fill it in at the end of the year, hoping to remember all the good work that they've done. And when you're sitting on the other side of the table, it takes me less than 30 seconds to realize that you're faking your logbook. Honestly, less than 30 seconds. The moment I see your CV and I look at your logbook, I will be able to pick up like this, that this is a genuine logbook or not a genuine logbook. Okay, so be very, very careful. When all entries over 3 years of residency training are filled with a single color pen, with this looking exactly the same from first to the 400th case, then it was filled 2 days before you were submitting your MS or MCH form. So I know that this is not a genuine logbook. Because genuine logbooks look different. Every time you may not have the same pen. So there are ways to pick up a true logbook or a genuine logbook. So clinical skills are very important. Your logbook is very, very important. And nowadays everything is on the computer. You don't even have to handwrite your logbooks. Everything's on the computer. And the other important thing is, on a computer, it takes me very little time to identify when an entry was made into the computer. So if you made all entries at the last day, then I can very easily, there is a way to look into that Excel sheet and find out on what date was the entry made. So don't think you can fool people. You must have a prospective, ongoing logbook. We do not expect you to fill it every day, but we definitely expect you to fill it every week or at least every month. That is the only thing that we want, not less than that. Okay, if you think you're doing once a year, that's not good enough. So it should be at least once a week or once a month. That is the least expected. Okay, all right. The other thing we also look at is clinical knowledge and expertise, and we'll talk about this in more details when I talk about shortlisting. And that, again, I look at your logbook to understand what is your clinical knowledge and expertise. And again, this is essential criteria which is described in the advertisement itself. Academic skills. I do want to know what are your academic skills. I'm very interested in knowing, can you teach? Can you do research and audit? Okay. So it is research and audit no longer is a desirable criteria. It is actually essential. And at the level at which we are operating, we are a super specialty. And if you have spent 5 years in the specialty and not published a single paper, or 5 years in the specialty and you have not done a single research, and you have not done a single audit, then you are no good to me. Because at the end of the day, I want a guy who will sit down on my computer, take my data, and publish my papers. That is what I'm looking for. I'm looking for ease of life. I have done so much work. I'm operating morning, evening. I don't have time to look through the data. So I want a research fellow. I want a clinical fellow who will take some time off on a Saturday and look through the data and get me 4 papers ready in 1 year. Okay. So that is why the research and audit skills are very, very important. And I'll show you how we shortlist. And you will be shocked at how much importance we give to research and audit skills. Personal skills, absolutely important. This is the most important thing. I'll tell you, what I do not want when I'm employing somebody is a person who doesn't know how to communicate. And I do not want a person who's not a good team player. These are the 2 important things. I don't want a headache. That is my most important thing. And I don't want my patients to complain that this guy doesn't know how to talk to us. So personal skills and communication skills are absolutely vital. And if in your CV, you can tell me that you've done a communication skill, or if you can show me feedback from your patients or feedback from your colleagues, I'm very happy with that. That adds value. So the personal skills is very, very important. You must be able to highlight to me in your CV that you are a good communicator, you are good with the patients, you're good with the relatives, and you're not a troublemaker. And the one place where I can sense this is from the references. Okay, when bosses give you references, there are 2 reasons why people give you references, good references. Okay, the first reason is because you're good, because you work hard, you're really good candidate, and the boss will write it in a certain way that communicates to me that you're a good guy, you're a good candidate. The second reason why you may have a good reference is because your boss is trying to get rid of you. Because you are a trouble for him, he's trying to get rid of you, but he does not want to write bad things. And he wants to pass on his trouble to you, and he will give you a good reference, hoping that he gets the job. But I promise you, when I read the references with years of experience, it's very clear to understand who has got a genuine good reference and which boss is actually trying to pass off his trouble to me. So be very careful about your referees. Be very, very careful. Make sure that they are ready to give you a good reference. And most importantly, make sure that they write good references for you, not write references because you're trouble. That is very, very important. So personal skill is actually essential criteria in the whole scheme of things. Okay, so let's look at personal skills a little bit more detail. It's very important. That's why we really pay a lot of focus on personal skills. So first and foremost is communication skills. So I want to see that you have done some course on communicating with patients, bereavement counseling. You have done a course on how to break bad news. You've done a course on, it may be a management course, art of talking, art of listening, art of speaking. I don't care what you've done, as long as you've done some course which shows to me that you're trying to improve yourself as an individual and as a physician. Because 95% of our work is communication. And 95% of the times, the patient feels good or bad if we are not able to communicate well with them. Okay, so communication is the most important, the first thing. And I want you to be able to demonstrate in your CV that you have taken some proper training of how to do communication skills. The next thing that I want to look in your CV and try to identify is that you have a concept of problem solving and decision making. Somewhere in your CV, you should be able to tell me that. And I'll talk about this in more details when we come to the CV itself. But this is essential skills, okay? This is not desirable, this is still essential. The third thing that I'm looking for is empathy and sensitivity. And these are buzzwords. Everything that I'm put on these slides is actually from an advertisement, okay? I'm telling you, this was there in the advertisement. This is exactly how the advertisement. We want the client to demonstrate personal skills, which includes communication skills, problem solving, decision making, empathy, and sensitivity. Very important in the Western world. You cannot, ignore this one. Managing self and managing others. Okay, and I'm sorry about the spelling mistake. Managing is an error. So managing others and team player is mandatory. I want the guy to be a team player. If ever in any of my communications with your referees or any of my communication with the fraternity, I find that you're not a team player. You're always fighting with your colleagues or you're fighting with your nurses. This thing gets out. You cannot hide it. I promise you, I will not hire you. I'm very clear. No matter how skilled you are, no matter how good you are as a surgeon, if you don't know how to work in a team, I will not hire you, because the game is team play. So always be very careful at your work as well. Please treat your team with respect, because the word gets out that you're not a good team player, and that's a problem. Okay. I want to look at organizational and planning abilities. That's part of the personal skills. I want to look at vigilance and situational awareness, and we'll talk about this a bit later. But get these words. These are straight from the advert, okay? So we are looking for these things. We want to make sure that you can actually, you can react to a situation. And most importantly is honesty, okay? Somebody's microphone is on. Whose microphone is on? Whoever's is on, just switch it off. Okay. So values, when we talk about values, the two things we are looking for, these are two words, and they're part of the GMC guidelines as well. And the two words that we're looking for is honesty and integrity. Okay. So if you have any issues with values, with honesty, if you've got a case against you of fraud, or if you've got somebody has complained about your integrity, then that makes me a bit hesitant about picking you up for the job, because I want somebody whose word I can trust. So it's very, very important that in your CV, you should be able to communicate to me that the two important values for me is honesty and integrity. And integrity means you can trust my word. If I say a patient's blood pressure was 120 by 80, it means it was 120 by 80. If you have not seen it, you say, I forgot to see it. You know, that's the reality. That's what we want. We want integrity. If you have not checked today's X-ray, don't tell me X-ray was normal. Do you understand? That's what I'm trying to get at. So integrity and honesty are two words. They are actually part of the GMC. Being a good doctor, they are very, very highly valued in shortlisting people. And somewhere you must be able to get these two words in, that I have the highest honesty and integrity. Okay, very important. Or you give me an example, I don't care. Or somewhere in your reference, these two words have to be mentioned, that you are honest and you are integral, which means I can believe your word. Okay, so this is very, very important. And if you cannot in your CV get these 6 or 7 points across to me, there is no way I will shortlist you, because these are essential skills. So now look at your CV and see what is missing, and understand that actually a lot of stuff in your CV is missing. If you look at this list of things, you're not able to communicate to me through your CV that you actually have these skills. And so it's very, very important that you work on these, okay? So the next thing in an essential skill, the other skills that we are looking for are probity. Probity means that, the medical council can give you a certificate saying he doesn't have any medical legal issues against him and things like that. I'm looking for professional integrity, very important. You should not have any cases against you. People should not have, you have not misbehaved with relatives of a thing and all that stuff. Then I'm also looking for commitment to specialty, which means that I want to know that you are not taking up a job in thoracic surgery just because you've got nothing else to do. Okay, you have to show me in your CV that you're allowed to change careers. That's not a problem. But if you've changed careers, you must show me progression towards my specialty. So the commitment to my specialty is very important, and I want to see it in your CV. And last but not the least is learning and personal development. You'll be surprised how many people's CVs do not reflect personal development. It is just, a lot of people don't even understand what is learning and personal development. And I'll try and teach you today, or at least give you a glimpse of what you need to do. So a lot of words today that I've put out to you may be new to you, or a lot of these words may sound like bullshit. They may sound like, these are just rubbish. Some language, they are using fancy language. But the bottom line is, this is actually essential criteria. I've picked all these words directly from the advertisement. And if your CV cannot demonstrate these essential criteria to me, there is no hope in hell that you will be shortlisted. So I want to see these words in your CV. So please remember, these words are very important. I want to see them somewhere in your CV being inscribed, or at least your actions showing me the commitment to specialty, or showing me that you've got a learning and personal development plan. We call it a PDP, and I'll talk about it a bit later. Okay. All right. So far, so good. Is it making sense, guys? Hello?
Yes, sir.
Yes, sir.
Yeah, it's making
Yes,
sense.
sir.
Are you guys making notes? One thing I would advise you is to have your CV ready next to you. I forgot to send that message out, but actually, if you have your CV ready next to you, you will very clearly realize that what are the things that are missing from my CV. And if these words are not appearing in your CV, then there is very little chance that I will actually shortlist you. Okay? Because I am looking for these words in the CV. So be very careful. Okay? So now the next thing is desirable skills. This is what this is the specialty of that job. I have advertised this job because I want to look for these criteria. So if you have desirable skills, there are higher chances of getting shortlisted. So whenever you make a CV, you first read the job interview, a job application, you read the essential skills, and most importantly, you read the desirable skills, and you try to match the desirable skills. And if at that point of time, you are not able to match it, it's okay. That job is not for you, but you make sure that you can fulfill that desirable skill so that the next time you make your CV, this or the next time a similar job comes along, this desirable skill has been tick marked. Okay, so very important. Now, desirable skills are higher degrees, very important. We really appreciate if you've got higher degrees, and I'll talk about these. And higher degrees means MCH, DMB, and stuff like that in the specialty. So if you got a higher degree in the specialty, very, very good. I'm very happy with that. Higher research degrees. Research degrees are different from MCH. So you should have, preferably if you want to get a national training number in the UK, we want you to have an MD research, we want you to have an MSc research, or we want you to have a PhD research. If you have any of these, very easy for me to pick you up. So higher research degrees is very highly valued in the scheme of things. We want you to have teaching experience. It's very important. A lot of people do not write in their CVs their teaching experience. And you'll be surprised the number of times we check for teaching experience in desirable skills. Very important. Management skills are very important. I want to see in your CV that you can do some management, or you've done an MBA, or you've done a healthcare management module. You don't have to have done the whole degree, but even if you've done a couple of modules worth 20, 40 points, I'm quite happy with that. And that will give you extra points when we shortlist. And you will see all this when I show you the shortlisting, how we shortlist. I want to see leadership skills. These are desirable skills. And this is again directly from an ad, okay, for a senior registrar, okay. So I want to see all of these in your CV. The next thing I want to see is IT skills. A lot of people don't write in their CVs that they are proficient in Microsoft Word, Excel, Outlook, and not Outlook, what's the other? The database thing. So I want you to mention somewhere that you're good at databases, okay? So very, very important that you mention all of this. PowerPoint, and the fourth thing, I just suddenly forgot the other one. I want to look at achievements outside of medicine. Very important. Oh God, this is, and the funny thing is a lot of you do it, a lot of you do charity, but you don't mention it on your CV. This is a desirable skill. It gives you a lot of extra marks in shortlisting. Achievements outside of medicine are highly, highly prized, whether it is music, whether it is sports, whether it is social service, whether it is ICT, anything, the corporate social responsibility. A lot of you guys do it, but you do not manage to put it in your CV. So achievement outside medicine is not a waste. It is actually a big plus point. Again, mind you, this is from an ad. So very important. This was just last week, this ad was put out. And I said, let me use it as an example for the students. We are looking for altruistic, voluntary, or social work. Very, very good quality when we want to appoint somebody to a job. Very good quality. And everybody has done some. Only thing is they underplay it in the CV. They're not able to mention it in the CV. We want to look for grants and bursary applications. We want to look whether you have ever got a research grant. Have you ever applied for a bursary from maybe a government department? Maybe a small audit. It doesn't matter what the audit was. Did you actually manage to get a grant for your hospital, for your study? Even if it's a privately funded, it doesn't matter. Some company, some drug company grant. That's okay. It's a very big plus point if you've got a grant. It's a huge desirable quality that we look for if you've managed to get a grant, which means that my next research, you will be able to get me a grant or at least write an application for the grant. So it's very highly priced if you've got a grant or bursary for your application, okay? And sports skills are very, very highly valued, particularly if you're a national or an international player, okay? It doesn't matter what sport, we are not interested in that. But if you are a national or an international level athlete, I know that you have the discipline in life to achieve big things. And I know you will be a huge plus point for my unit, because people who achieve these levels of achievements are disciplined people who understand the meaning of a goal and who understand the difference between a goal and a dream. And so these are the people I want to be working with me. So these skills are very highly valued when we shortlist people for jobs. Membership of relevant surgical bodies. So, you can't apply for thoracic surgery job and not be a member of IACTS or a member of some thoracic society, European Society of Thoracic Surgery, or EACTS. But you need to show me that the moment you're a member of a relevant surgical body, I know you're dedicated to the specialty. Also, when you attend courses, I can look at it and I know. So it is important. It's a desirable skill. It shows your commitment to the specialty. Courses and conferences in the specialty, very important. Okay, very, very important. You'll be surprised how many people don't write all the conferences that they've attended. A surgical logbook is now again a desirable. So it comes in essential and also comes in desirable. If you can give me a synopsis of your surgical logbook in your CV, you've got the job. I'll be very happy with that. Okay, there are points for that. I give you some points and I'll show you how we point it. Surgical projects. If you've undertaken projects like research in a dog or research in an animal or animal lab, vet lab, anything, or a teaching project where you did a vet lab teaching, all of that is very highly prized. It is a desirable skill. And I am looking for that in your CV. And last but not the least, innovation. You'll be surprised how many people don't write about innovations in this. If you've invented even one small thing, it may not have been patented. It may not have been, registered in your name or something, but at least you had an idea. You must put it in your CV. Innovations I mean, honestly, if I ask, how many people do we have? We have 32 people on the lecture, on the group just now. And if I ask 32 people will tell me they do not have a tablet, they do not have a subsection in their CV called as innovation. And I'm pretty certain everybody has done some innovation or the other in surgery. So even if it's an idea, it's okay. In fact, if it's an idea, it's very exciting. It shows to me that you're actually thinking out of the box. And we would love to hear those ideas. So innovation should be on your CV. It is a huge plus point. It comes in a desirable skill. If I see innovations, I am excited about the candidate. I want to take the candidate because he will bring something new to my unit. So I'm very, very excited about it. Personal development portfolio. Now, a lot of people don't even know what's a PDP. Okay. And I think this is a completely whole lecture where I can talk to you about how to write a personal development portfolio, a reflective log, and appraisals. These are very, very, very important. Okay. A personal development portfolio actually is a portfolio which shows me through your years what you have done to improve yourself. A reflective log is a very important document. It actually tells me that you have spent time trying to understand where you were good and where you were bad. So say you had an adverse event. Say you went into the theater to do a wax lobectomy and by mistake you cut the pulmonary artery. Okay, and there was bleeding and you had to convert it into an open thoracotomy and you managed to control it or the patient died. It doesn't matter what is the outcome. A reflective log is when you come back in the evening or 2 days later and you sit down and you document what happened. Why did this incident happen? What were the things? It's called as a SWOT analysis: strengths, weaknesses, opportunities, and threats. If you can do a SWOT analysis of the event and write down things, and at the end, if you can write down, this is what I learned from this event, then that is a huge plus point. And if in your CV you can tell me that you have a reflective log, I promise you in the interview, because I want to read your reflective log, I will shortlist you and I will in the interview ask you questions from your reflective log. And I want to learn from your learning. And so very, very, very important to have these two documents: a personal development portfolio, which you carry with you in the interview. I always, whenever I had to go for any interviews, I would carry this thick file with me and I would have 5 copies made so that I give it to each one of the interview panel so that they can read through and understand that I know where I'm going. The PDP just says that I am somebody with a goal and a dream, and I know the pathway that I'm taking to get to that goal and dream. And a reflective log is very important tool. Even today, I do a reflective log. Anything goes wrong, even if while I'm doing this telecast of this lecture, and if something went wrong or some IT failure happened, I sit back the next day and I'll write down and try to think out, why did the IT failure happen? What connections were wrong? How can I make sure that the next time there is no IT failure? How can I have the light better? How can I have the sound? Or when you do video editing of your videos, you're actually doing a reflective log. You're trying to understand. So in your CV, I want you to be able to demonstrate to me one line somewhere, if you can say that I have a prospective reflective log, you have got me and I will shortlist you. But hardly 1 out of 2.5 to 3,000 CVs will have this word reflective log in the CV. And so it's very, very, very important. Appraisals is again a completely different topic, which we can talk about in another talk. But if you've done appraisals in the way the GMC has described, then very important, we will actually give you plus point. And a 360-degree portfolio. This is again, so this whole slide is a completely different talk, which I can do with you sometime if in future, if you want to learn how to do a 360-degree portfolio. A 360-degree portfolio is when you can demonstrate to me that you're a good surgeon by having feedback from your patients, feedback from your scrub nurse, feedback from your colleagues, from your supervisors, from your bosses. That is called as a 360-degree portfolio. So you are looked at all around. And the 360-degree portfolio is a document which is used by the General Medical Council for revalidation. So every 5 years, we are supposed to go in for revalidation. So we actually have to prepare a 360-degree portfolio. And if at your level, if you can put it into your CV that I have a 360-degree portfolio, you got me. You got me. It is a buzzword. And I will actually want to meet you because I want to see what is your 360-degree portfolio like. So very important, these words, okay? All right. So far so good. Are we okay? Are we bored? Is it getting to be stupid or is it okay?
It's good, sir. It's good.
Is it making sense? Something new?
Absolutely.
Or is it the same
Yes,
shit
sir.
that we're talking all over again? Okay.
But sir, I never heard all these things.
You've
So-
never heard all these things. Okay, excellent.
It's
So
really
very good.
informative, sir. It's really
I'm very
informative.
happy that we are getting some good information to you. So now look at shortlistings for job. So look at how we shortlist people for job. Okay, all right. So everything is actually point based. So no, the fact that you have not been shortlisted does not mean that we are biased against you, and it does not mean that we don't like your ethnicity, that you're African, you're Asian, you're white. That's not the reason why we don't shortlist you. We don't shortlist you because you have not got the marks. And the shortlisting is a very straightforward procedure. Very straightforward procedure. And it is point based. So if you have fulfilled all the criteria, you will get the points. There is no way I can deny you the points. In fact, you can challenge my shortlisting legally. Do you understand that if I'm applying for a job and somebody doesn't shortlist you and you have fulfilled all the essential criteria and all the desirable criteria, you can go to court. You can actually go to the court and you can sue the hospital saying, why have I not been shortlisted? So it is very, very organized and very systematic. And I'll show you how it goes. So we have marks which are awarded for every points that you have, that you put out in your CV, okay? And the marking is 0 to 3 for each subheading. So the whole CV is divided into multiple subheadings and every subheading has 0 to 3 marks for it, okay? Maximum marks that you can get out of a CV is 40, okay? And you will find that our Indian kids and our Indian students and Asian students, usually when they first start off the game of applying internationally, they come around 20. Okay, they're able to get around 20, 18 to 20. The Europeans and not the European, the British, the local students, straight away after finishing the MBBS and MS, if they apply, they are able to get 30 plus straight away because the way they make their CV is different. like somebody just told me, I've never even heard of these things. So these are buzzwords which have to come in the CV. And if they're not there in the CV, how can I give you a mark? Because there is a subheading for it. And in that subheading, if your CV doesn't represent that subheading, I will give you 0 marks. I cannot give you a mark. So a lot of you don't even qualify. You come to 20 and you stop. But the game is 35 and above. If you want to be shortlisted, you have to be 35 and above. Okay. In fact, closer to 40 is better. More chances of you being shortlisted. So look at the first one. Okay, employment history. Now the way this is designed is first one. This is a column, and I'll explain these columns to you. It starts from what we are looking for. This is 0. This is 1. This is 2. This is 3. And this is the total number of marks that I can give you for this subheading. So in employment and history, if you've got poor career progression, you've got a lot of gaps, you cannot explain the gaps to me, it's a 0 straight away. Okay. If you've got a satisfactory career progression, you've done MBBS, you did MS, you did MCH, you did a registrar job, you did a lecturer job, you did an associate professor job, that's a good satisfactory career progression, you'll get 1. And then if it's a good career progression, if you've really, the time frame has not been exceptionally long, it didn't take you 7 years to get a registrar job, you have all done within 6 months, you've done this, 6 months, you did that, 6 months, then you get a 2 point. Okay. So straight away, first on your employment history, we mark you from 0 to 2. There is no 3 on this criteria. Okay. Every criteria is different. And I'll take you through each one of them, how we shortlist. And this is the national shortlisting for cardiothoracic surgery. This was last month when we were shortlisting people for national training numbers. Now, I wasn't involved with this shortlisting, but I had the marks, the shortlisting criteria come to me, and I looked through that and I prepared it for you guys. So first is employment history. So 0, 1, or 2 marks. And straight away you can get 2 marks. There is no reason why you cannot get 2 marks out of this. And a lot of us get 2 marks straight away because we have quite a decent career progression. Okay, undergraduate training, awards, and researches. Okay, I'm going to move this picture this side. So okay, so undergraduate training, research, award, prizes, and audit. Now this carries a 0 to 3 marks. Okay, so straight away, if you've had no awards or you've had no prizes, 0 marks. No audits, 0 marks. If you've had 1 or more local award, even within your hospital or within your university, if you've had 1 award, we will give you 1 mark for that. Okay, so don't underestimate these local awards. They carry 1 point with them. Okay, so please put them in your CV. If you've got several distinctions, you've got several awards, you've got a state level award, more than 1 award will give you 2 points. And then national and international award will give you 3 points. Okay, so very clear cut marking. There is no bias here. If you have had some national award for work or academic or clinical excellence, if you look here, it says prize recognizing academic or clinical excellence. Anything you've had nationally, or you won the prize in the IACTS conference for the best paper, that is a national and international award, and that will give you 3 points straight away. Okay, so it's very, very important to look for the awards. Even these conferences which give you awards, you must put that in your CV. It is very important. We actually mark you for the awards that you get. Okay, so looking at electives and attachments. Okay, undergraduate clinical electives and attachments. If you haven't done any electives relevant to cardiothoracic surgery, look here. It is talking about relevant to cardiothoracic surgery. No points. If you haven't worked in cardiothoracic surgery, we don't want you. If you've got some electives, and usually substantive elective doesn't mean 1-day tour or a 1-day visit to a unit, usually something more than 2 weeks. So if you spend 2 weeks in Shanghai Pulmonary Hospital or in Shanghai to learn uniportal VATS, that's good. We like that. We will give you 1 extra point. Or if you've gone out of your hospital and gone to Dr. Santosham's hospital for 2 weeks or more to learn tracheal surgery, we give you plus points. It's 1 point we add to your elective. So electives are very important. Elective means what you choose outside your normal working hours to go and do. So, it's also called as sabbaticals. So if you've done a sabbatical for 6 months, year in another unit, in another country, very, very good. Does matter. if there are many electives, several electives, you have possibility of getting 2 points. And we cannot change this. We cannot. If you've done 3 or 4 electives, they have to be more than 2 weeks. We have to give you the 2 points. There is no two ways about it. And this is so easy to score. This is something that you can straight away score. You can show that I spent 1 year in Tata Memorial Hospital to learn cancer surgery. It doesn't have to be, in the thing, but it shows that you're dedicated to lung cancer, and you're dedicated. And now you are come back to your unit and you started doing thoracic surgery for lung cancer. Excellent. 2 points for that. Okay. And these are guidelines. These are national guidelines. I'm not making these up. These are national guidelines. So these are very, very well laid out, and your CV has to represent them. Okay. So let's look at this one. Postgraduate training, higher degrees. Okay. You don't have a higher degree, 0 point. You have one registered higher degree in the subject, you get 1 extra point. It could be a BSc, a research degree, or it could be a MSc, it doesn't matter. If you've completed postgraduate or master's in the subject, in that particular subject that you're applying, so if it's cardiac surgery or thoracic surgery or cardiothoracic or vascular surgery, you get 2 points for that. And if it's an MD and a PhD in the subject, you get 3 points straight away. Okay. So very, very important, very clear-cut marking. There is no bias here. If you've got a PhD, you get 3 points. Let's look at other degrees and diplomas. Okay, so let's look at other degrees and diplomas. No other degrees and diplomas, you don't get any points. If you've got one postgraduate degree and diploma besides what you have done, like if you've done an MCH cardiothoracic, MCH CVTS, and you've also got an MSc in clinical research, or you got a MBA in finance, that's 1 extra mark. Okay. So one postgraduate degree counts quite highly. It gives you that extra point. And that point is very important, because that is the 1 point which might tip you over into being shortlisted. If you've got 2 postgraduate degrees, you get 2 marks. Or if for this, the important thing is MRCS and MRCP is not counted. So if you've done MRCS, we don't actually count that as an extra qualification. MRCS is in the UK considered a basic level entry program exam. So MRCS and MRCP does not count for the extra degree points. But research, teaching and management does get counted. So if you've done a degree in teaching, you've done modules in teaching, you've done an MBA, you have an MSc in research, it matters. If you've got 2 degrees like this, then you get 2 extra marks for it. Okay. So very, very important to understand that. You need to be able to show that you have done any of these. So all the time in your career, please, it doesn't have to be a face-to-face. It can be an online degree. It can be a, go to Open University and do a degree through Open University. While you're doing your 3 years of MCH cardiovascular thoracic surgery, you can do 1 degree in something else. It doesn't matter. All you have to do is to do a few submissions, do 1 exam at the end of 3 years and finish it. But it is important that you do these degrees because they add value. It could be a degree in law. It could be medical legal degrees. All of this adds value. So there are 2 points actually you can gain from this subgroup. So very important. Okay. Now postgraduate research, very highly valued. We do. If you have no research, there are 0 points. And if you've got substantive research which we didn't count elsewhere, then we will give you 1 more extra point. So there is 1 more extra point to be gained by research. So if you've done research in colonic cancer, we didn't count it in the previous things, then you get 1 extra mark for it. So don't think that your general surgery research is wasted. We have a special category for other research which was not counted before. So if you've done, some presentations, you've published a paper in general surgery, that counts. It gives you 1 extra mark. Okay, let's look at postgraduate clinical courses. No postgraduate courses, 0 marks. Adequate postgraduate courses for career stage. Okay, so we understand at what level you are, and you've done a few courses here and there, you'll get that 1 point. But if you have a strong commitment which shows that you have done basic science courses as well as clinical courses, so you did a Birmingham Review course, and you did a Royal College of Surgeons basic science course, or you did the IACS basic science course. So don't forget the online teaching that you're having with the IACS. You must actually try and talk to the IACTS and ask them to give you a certificate of attendance. I kept talking about CMEs for the lectures, and that CME for the lecture counts here, okay? Because if you can prove to me that you've done a good CME for a lecture for my specialty with a certificate attached to it, I will give you 2 points to it, okay? So very, very important to get these recognitions for the courses. Now let's look at presentation, okay? No presentation, 0 points. If it's an oral presentation at a regional meeting or a poster presentation at a national meeting, you get 1 point. So oral presentation at regional meeting or poster presentation at a national meeting is 1 point. If you got an oral presentation at a national or an international meeting, that's 2 points. And if you're first author, presenting author, you got to be presenting author. If you're presenting author, you get 2 points, okay? So this what I'm trying to show you is not for this job, but I'm trying to show you how your CV matters when we are shortlisting. If you don't have any of these in the CV, you will lose out. And so this gives you an understanding of why you are not shortlisted for the job, okay? All right, let's look at publications. No peer review publication, 0 points. If you're a named author, you have to be a named author. In a peer review publication chapter or a substantive review, you may not be the lead author, but if you're a named author, 1 publication, you get 1 mark. If you're the first author in a peer review paper, in a journal, in a proper journal, peer reviewed journal, or you have 3 publications with your name in it, or you're an editor, or you are a chapter writer, you're an author for a chapter, will give you 2 marks, okay? So first author in 1 published paper or 3 papers with your name somewhere as second or third author or whatever, or as a chapter editor, you get 2 points. And if you've got 3 or more first author papers, you get 3 points. Or if you've got a chapter where you are the first author, that counts as well. So 3 or more counts for 3 points. So this is very, very strong. 3 points can be earned bang, because being a first author is not difficult. You just need to write a paper, you know, and in the career of 3.5 years, 4 years, 5 years, if you cannot produce 3 papers, then you're no good to me. You're absolutely no good to me. I want somebody who will actually be able to write a paper for me. At my level, when I'm shortlisting, I am not interested in being first author. I'm interested in being last author, which is the senior author. So I want a young person like you who will write papers and publish them. So if you got 3 or more, you've got 3 points there. So very, very, very important. This is how we shortlist people. Okay, clinical audit. Most people, unfortunately, do not write about clinical audits in their presentations. It's just in their CVs. It is just awful because clinical audits carry 3 points. It's not 1 or 2, 3 points. Okay, so if you've not done an audit, it's 0. If you've got substantial involvement in an audit, which means you can show me documentary proof that you were involved. You may not be the author of the audit. I will give you some credit for it. You'll get 1 point. But if you were in a leadership role in the design, conduct, and presentation of the audit, you get actually 2 points for that. And the most important thing is if your audit can show that there is an evidence of clinical impact, which means you did a re-audit. If you can show in your audit cycle that you did a re-audit and you showed that your audit changed clinical practice in your hospital, it doesn't have to be national. It's just your hospital, your department. If you can show that, that is 3 points straight away. So what does it take to do an audit? You know, I mean, listen, an audit can be, should you do a post-operative chest X-ray in the recovery room or the next day? That's the audit. Now you do 100 cases, look at the findings and say that out of 100, there was no difference in the chest X-ray being done within 4 hours or being done next morning. So you made a recommendation that actually you should not waste money and time for a chest X-ray in the recovery. And now in your unit, the standard protocol has become that the chest X-ray will be done next morning. That's an audit. That's a clinical impact. As long as you can demonstrate to us that your audit made a clinical impact, that's 3 bloody points. Audit on a chest X-ray, for God's sake, please do it. It's very, very important. Any small audit is important. It matters. It impacts your performance. And for us, because in the Western world, audit is everything. We have to show all the time that we are auditing our work. Okay, very, very important. For my personal career progression as well, audit is very important. So if I've got a registrar who will do the audit for me, why will I not shortlist? It is as simple as that. But you need to understand what is an audit, how to do an audit, what is an audit cycle, how to re-audit, and your CV must be able to demonstrate to me that you can do a re-audit. So very, very, very important. Okay, all right. Organizational and leadership skills are pretty important. No leadership skills, 0 points. Evidence of personal involvement in local committees, charities, or project development, 1 point. Chair or secretary or leadership of a local or regional body has got 2 points. And chair, secretary, leadership of a national, international body or a project. Okay, so this doesn't even have to be in medicine. It can be outside of medicine, but you have a chance of getting 3 points. Okay. Practical and psychomotor. Is it making sense what I'm saying, or is it getting too detailed? Hello?
It's good, sir. It's good. We are following.
You're
Yes, sir.
following, it's making sense.
Yeah.
I
Yes,
don't want
sir.
to talk about the
Absolutely.
CV straight away. I want you to understand what we are looking at before we get you into the CV. Okay. So
Yes, sir.
once you understand the way I'm shortlisting, then you will put this in your CV. You understand that? That's the
Sure.
point I'm trying to make. And this is a real number. These are not something I made up. These are national numbers which we look at. So this is how we shortlist. Okay, let's look at psychomotor and practical skills. So outside of medical training, if you've got practical and psychomotor skills which you can demonstrate to me, something in sports, craft, design, or technology, if you've written a new app, or you've designed a new database, or you play cricket for West Bengal, I am very happy with that. That gives you 1 point. If you have got a high level of attainment in sports, something higher than just involvement, excellent, 2 points. And if you're a national or an international athlete, or if your design and technology actually changed practice or was picked up for a patent, 3 points. Can you imagine that? Technology and even arts. So we don't just look at medical science. We are also looking at more. So don't think the other stuff that you've done is not important. It is very important to represent it in the CV so that we can pick you up for that. Teaching is very important. Again, no teaching is 0. Occasional teaching is 1. Regular teaching commitments with including development of personal teaching skills, which means you've done a course, you have attended learning teaching modules, you know the various types of teachings and things like that. If you can demonstrate that to me in your CV, then you'll get 2 points. And if there's a major commitment, which means that you're, that's why whenever I do a wet lab, I always make sure that a youngster is put in a management role in the wet lab. Always, in all my wet labs, you'll find that there will be a young surgeon who I will put as director or course director or co-director. The reason for that is this. There are 3 points. If you are a co-director in a national wet lab, you may not be teaching, but you have a commitment to teaching. That's what it demonstrates. And then when you go back in your CV and you write that I was a course director or a co-director along with Dr. Khan in the IACS VATS wet lab, that picks up, that gets picked up, and that gives you 3 points in a shortlisting in an interview. So this is one of the reasons why we always push you guys into leadership positions in our teaching programs. See now, Vikas has done these lectures for us. Okay, Vikas has done, and all the other guys who have done lectures for us. These are international lectures in international series. And straight away, the commitment is there for teaching at a national or international level. So Vikas in his CV can write, I am involved in international teaching program along with Dr. Khan in thoracic gurus, 3 points. So do you understand where I'm coming from? So that's why it is important to be part of these programs, because we have a game plan when we try to promote people and when we are trying to promote youngsters to grow. We have a game plan. We understand the bigger view, and that is why we ask you, please do a lecture, do a talk. It's for this reason, because we know this shortlisting. Somebody's this is on. Guys, shut off your microphone. Abayomi Oguns. I love your child's voice, but he's talking in the room. Okay, all right. Okay, next point. Let's look at the next. So now, so many things are more important than operative skills. Did you realize that? So people are running after trying to do hundreds of operations and CABTs and ABRs, and they don't count. They count for 3 points only. In the career development, if you want to do the next step, if you want to do an international fellowship, I don't want you to be a proficient surgeon. If you are a proficient surgeon, why are you coming to me? Why would I shortlist you for my job? You don't need to learn anything from me. So I don't need you to be a really proficient surgeon. That is what the point I'm trying to make. So don't focus so much on operating. Focus on overall development, and that is what matters when we pick up people for international jobs. So if you've done appropriate procedures and operative skills for career level, you have 1 point. Above average procedures and operative skills, 2 points. And if you've done good, like if you are in your final year of MCH, cardiothoracic surgery, and you tell me that I have done 20 bottom ends, that is excellent. That is excellent. That would put you into the 3 category. You understand that? Because I know that at your level, when you're getting to third year MCH, you may or may not get bottom ends. You may get valves to do, but you may not get bottom. So if you can show me that in your CV, then that is good. And that I will put it in there. Or if you put, I've done 100 watts. If you've done 100 watts, fantastic. I mean, it may not have been lobectomy, but it is 100 watts, and that matters. And that gives you 3 points. So that is the level that we look at in operative skills. And last but not the least, most people forget this. Most people's CVs do not have a personal statement. And this is a very powerful tool. This is the one thing. This is called as your vision statement and your mission statement. If your CV doesn't have a vision statement or a mission statement, you're no good to me. So if you meet the essential criteria, no good. That's not the point. The point is you have to be above average in some domains. Okay, you've got to get desirable criteria. And if you're strong all-round academic, clinical, and personal domain, you get 2 points. And if you're all-round academic and clinical and personal domains, but a well-written personal statement with maturity and insight. And most important for me is a clear career pathway. If you know where you're going and you write it in your CV, I will pick you up. That is 3 points straight away. This personal statement in a CV is vital. It is what decides whether I should pick you up or not. So I read people's personal statements. The problem is 99% of CVs don't have a personal statement in them. They don't have a vision statement and they don't have a mission statement. I bet you don't even know what is a vision statement and what is a mission statement. So I want you to Google up these 2 words. What is a mission statement and what is a vision statement? And I'll come to that in a bit when I talk about CVs. Okay? So far, so good? Bored or not bored?
Yes, sir. Yes, sir.
Yes, sir.
Good, sir.
Not bored? Good.
Yeah.
Okay, so now we come to CVs and we try to understand how the hell should I make a CV, okay? So don't make a CV before. You have to understand what is the requirement of the job, because the CV is written to match the job, okay? That is the way you make a CV, not make a CV and then look for jobs, okay? Always a CV is written to match the job. So you must have a shell of a CV, always. You must have a baseline CV ready, but every time you apply for a job or an international fellowship or criteria, you must look for what is that job bringing. So 2 questions have to be answered in your CV. What do I bring to the table and what does the job bring for me? So what can I do for the job? What can the job do for me? These 2, if these 2 marry in your CV, then you get the job, you get shortlisted. So the CV is actually about yourself, okay? This is a very powerful document. It's a very powerful document. It is, you are the product. Consider it as a product. Consider it as a commercial venture, okay? And you are the product. And your CV is representing you. So what sort of a CV would you make out for you as the product is the key answer, is the key question that you have to ask yourself, okay? Now, the why is very important. Why means what do you bring to the table and what the organization brings for you. So if A meets B and B meets A, you are the correct person for the job. And your CV should be able to answer that. So your CV should be able to answer essential criteria and desirable criteria. If your CV matches the essential and desirable criteria, and if you look at the shortlistings, if I cannot cut points, they're all clear cut. They're written down. If you've got a PhD, you got a PhD, I have to give you 3 points. I cannot deduct points. So if you can match the essential and the desirable criteria, we will shortlist you. Okay. So this is what your CV is. So question, if you had a CV in your hand and you looked at your CV and you ask yourself, is this a brochure for a Mercedes or is it a brochure for a takeaway? Okay. That is the question you have to ask yourself. Have you ever gone into a Mercedes showroom and have you ever felt their brochure? When you turn a Mercedes brochure, the feel of the paper is different. Yeah. The color is different. The matching of the colors is different. Yeah. So when you turn it, it smells luxury. Okay. It smells luxury. By the same token, if you go to your local takeaway, what is the word in India? You got parcel you call it, isn't it? So if you go to a local hotel parcel and he gives you his menu to order chicken tikka roll, the feel of the menu is different. Okay. So the question you have to ask yourself is my CV like a Mercedes-Benz brochure? So when I am shortlisting you and I'm feeling your CV and reading your CV, am I getting a feeling of Mercedes-Benz or am I getting a feeling of a takeaway? Okay, something like this, with free coupons attached to the side. And that is the difference between a good CV and a bad CV. It's very simple. It's very simple. You'll be surprised how easy it is for me to identify this and the difference between this and this. Very easy. So from 200 CVs to go down to 180 is a piece of cake. It takes me less than 30 seconds per CV to throw 180 CVs into the bin, because all of them are like this. Okay. Which is, you've made a CV 20 years ago and you're sending the same CV everywhere for the last 20 years. Okay. So first and foremost, the thing I look at in CVs is paper. You'll be surprised. These are mistakes that people make. The quality of the paper, the quality of the printer, terrible print. Oh God, it was that inkjet printer with all lines drawn across and half the thing is visible, half the thing is not visible. You photocopied it and you send it because you couldn't be bothered to put it on a proper inkjet printer. I want a laser printed CV always, and I want a laser printed CV with good ink in there, not half the ink disappearing. So paper quality is important. The printing is very important. It has to be straight, crisp. I should feel it. As soon as I turn the CV, it should look good. It should feel, my eyes should feel right. The folders are very often the CVs are sent in envelopes which are all crumpled because the postman just didn't bother keeping it straight. So you'll be surprised the number of times I get CVs with folded papers or crumpled, or somebody is to save his postage, he has folded it and put it into a smaller envelope and send it to me. And I'm not going to bother with folded paper CVs. I just put it into the bin. I don't care how good you are. But if you cannot have the decency of sending me a decent CV, which is clean and crisp, I'm not going to bother with it. I'm going to throw it into the bin. Wrinkled paper. The number of times you'll find CVs with wrinkled. Actually, the papers are wrinkled. And I'm not exaggerating here. These are all real things that happen. Even worse than wrinkled paper is when I find food marks. I find sambar on a CV, or I find curry mark or something on the inside page because you couldn't be bothered sending me. You were eating a pizza while you were putting this CV on. Your hands were all oily and that oil got transferred on the paper. And really, you think my job in cardiothoracic surgery is of such a crap quality that you couldn't be bothered sending me a good clean CV? I take it as a personal insult. When any of these 5 or 6 things come up, it's a personal insult to me and I throw it. Because what this shows is that this is the same attitude you will have intraoperatively when you're operating on a patient. If you're not careful enough to send me a good CV, you're not going to be careful enough working around the pulmonary artery or the aorta or the coronary artery, because I want precision. I want clarity of thought. I want crispness. And any of these things turn up, you're not a good candidate for me. Straight away, I will reject you. Even without looking twice, I will reject you. So very, very important that your CV must not have any of these. Okay. Almost all the time, if I send a CV to anybody, I will send it in a plastic folder. Always, always. All my CVs are in a plastic folder so that none of this happens. Okay. Never ever. In fact, any document I send to anybody, I always put it in a plastic folder. Doesn't cost you anything. 5 for 100 rupees, or for a pound, you will get 5 of these. But I will take the care to put the CV into a plastic folder with a clear paper at the front and a colored paper at the back, so that my CV in transit does not get crumpled, does not get destroyed, or the paper doesn't get folded at the apex. Very, very important. A lot of times I see CVs with a staple on one side and they send me the CV. And really, you want me to read a CV with a staple on one side and turn it upside down like this? Really, you expect me to do that? Somebody who does robotic surgery, really, you're going to put one staple at the end of the CV and give me a CV and say, sir, could you just go through the CV and shortlist me for your job? I mean, you didn't even have the courtesy to put it in a proper folder and present to me in a proper way. And you think I'm going to give you a job as a fellow in robotic surgery? You're dreaming, my friend. So that's very important. Do not put one stapler at the edge of the CV and send these CVs off. Very, very bad habit. Very bad habit. And you'll be surprised how many people do that. They don't even bother putting the CV into a proper plastic cover or a sheet. Okay. Now, this is important. You must understand, when I turn the page, okay, of your CV, when I go from page 1 to page 2, I must feel quality. It's a subconscious thing. I must feel that I'm dealing with a quality person. And so please do not send me on cheap photocopied paper, your CV. Your CV should be at least 90 to 100 grams paper. Okay, higher in fact. 120 to 140 GSM. This is called a GSM. Go into your local printing shop and look for it. Look for GSM of a paper. And if you don't even know what is a GSM of a paper, you're no good to me. You must be able to say. So when I turn the paper, my hand should feel quality. Okay, when I'm turning, I know, this is a good guy. Like a Mercedes-Benz brochure. When I turn the Mercedes-Benz brochure, I feel, this is luxury car. It must have leather seats. The seats must be heated. Even without telling me, you are telling me quality. So always, always, always print a CV for important jobs, or for the one that you really want, please print it on a high GSM paper. Okay, very important to read about the GSM of a paper that you're going to print on. Always it has to be a laser printing, never anything else. Inkjet is not good because inkjet blots. Okay, inkjet is liquid, and so the liquid blots away. A laser print is what you want. So every CV should be in laser printed. Okay, crisp feel. Watermark paper, always you must have 120, 140 GSM of watermark paper. Can you see this? If you look carefully into this picture, can you see the watermark in there and the vertical lines and the horizontal lines? When you turn this page, the feel is different. It feels Mercedes-Benz. It doesn't feel this. See, you guys are not applying for an MBBS position. You're applying for thoracic surgery, cardiac surgery, the cream of the cream. You have to prove to me that you are the cream of the cream. And if your paper is not cream of the cream, it's a rubbish photocopied paper, I am not going to shortlist you. So this is important, okay? The watermark paper smells quality. It doesn't cost you much more. What is it? I mean, a few hundred rupees extra, but the job will give you thousands of pounds extra. Okay, it is the job which will give you, 10,000 pounds a month, 5,000 pounds a month salary. For God's sake, you cannot afford to apply it on a decent paper for the returns. Return of investment of 5,000 pounds, you cannot buy 200 rupees worth of good paper. So very important. The paper is very, very, very important. Okay. Okay. What are common mistakes that you make? Are you still with me, or is it getting too much?
Yes, sir. We are with you.
Yeah. Are you understanding where I'm coming from?
Yes.
It is important to understand my passion and my feeling for this. because that is what will be. If you don't have the same passion for your own self, how will you demonstrate that passion to me? You understand that?
Yeah.
That is what I want you to understand. That a CV is your chance to show me quality and class. It is about you. You are the product. And if you as a product is not quality, I am not interested. Okay. So what are the mistakes that you make in a CV? Okay, let's go through the mistakes. The first and commonest mistake 99% of CVs do is they do not tailor the CV to the target role. Okay. You do not write your CV for the job. You write your CV and then you apply for the job. Okay. That's not the way to do it. You have to read the job application. You have to read the essential and desirable qualities required for that job. And then you have to write your CV. That is the first mistake which most people make and straight away get discarded because they are not matching the requirements that we are asking for. Okay. Wildly unproven claims. Oh my God. The number of times I've seen CVs which say India's first, world's largest, God knows what. I mean, really, don't go crazy with your appreciation of yourself. Always use good language, but don't use expletive languages. The world's best. A lot of people write, published a case report on India's only reported case of hydrated disease or some shit like that. And very quickly we can pick it up and come on, man, what the hell is he talking about? Unprofessional email, okay, very important. Now these mistakes I've caught from a professional CV guy who wrote to me and said these are the mistakes. So unprofessional email means your email is not professional. Dr. azkhan@gmail.com. Your email is bakwas123@gmail.com or Disneyland@gmail.com. I mean, this is not. I'm never going to reply back to Disneyland or wildstud@gmail.com. I mean, for God's sake. So don't make that mistake. Have a professional email for professional work. Okay, you can have those things for your personal social media things, but we are not interested. Have a professional thing. Writing big unbroken chunks of text. Okay, a lot of people write a lot of things on CV, and I'll talk about this in a bit. But don't write too much. Always be points. CV should always be points. I don't want to read a paragraph. I don't have the time to read a paragraph. I don't want Mahabharata. I really don't want Mahabharata. I want just point wise. 1, 2, 3, 4, 5. Clear cut. What is your goal? Okay. Not proving your impact, which means that you just write things because you have to write it. And we can very quickly, when you get CVs written by a professional person, or you pay somebody to write your CV, we can very quickly pick it up. Very, very quickly that this CV has not been made by the guy. He's paid somebody to write it. Using meaningless generic cliches. Okay, these are all stuff which is written by these guys who offer you CV services. Never ever use them. Okay, never ever use a CV service. Clear reason for leaving a job. If you move from one job to another, that's absolutely fine. But if you cannot give me a clear reason, and the reason is not career progression, then I'm going to worry. Why did you move your job? Were you not good enough? Or did you have a problem with a colleague? Or did your boss not like you? Why did you change your job? And if your job is that, I got more pay, fine. That's absolutely all right. Or I got a higher position, that's fine. We understand career progression. But if you cannot give me a good enough reason for leaving a job, then I start to doubt a little bit on the CV. Salary requirements. People have crazy salary requirements. If you don't match the salary requirements for a CV, for a job that you're looking for, if the standard NHS pay is 70,000 pounds per annum, and you say I want 150,000 pounds, they're not even going to bother with you. So this is a common mistake people make. Salary requirements. Logos and images are no good. Do not put images in your CVs. Certainly do not put your face and stuff like that. I don't like CVs which have photographs of the person. You're not supposed to, put your photographs in your CVs. That is not professional. Okay. So don't put your photographs. Not enough detail of the current roles. and too much detail of the past role. So the current job that you're doing, I need to understand what is your level of work that you're doing in the current job. And when you write your logbook, I want you to understand whether is it performed, performed assisted, or assisted. Very important, because there's a big difference between performed and assisted. So I want you to clearly write in your operative logbook, perform, performed assisted, assisted. A synopsis of your logbook in the CV is quite important. Okay. Templates is not good. Using templates for a CV is not good. And you'll be surprised, many times people use a template and they forget to remove the instructions of the template. Sometimes it's written, write your name here, and they will forget to remove that and write their name below it. And it's so stupid mistakes like that. And colors on the CV are no good. They are completely frowned upon. Excessive word repetition, messy page transition. Always when you're going from one page to another, the one thing you have to remember is you got to put page break. Okay, you on a CV, you should never tab to the next page. You must put insert break. So when you insert page break, what happens is the next part goes on to the next page. So if you make any changes on this current page, it will not change the tabulation of the next page. You understand? A lot of you don't understand what it means. A lot of you keep typing in things and then you find that the CV is looking really crazy. One page going on to the next page, half a line is here and half a line is on the other page. That is not good. You must use proper page break to design your CVs, and we'll talk about it a bit later. Photographs are no good. We don't like CVs with photographs. And too many pages, too much rubbish written is no good. Okay. Ordering roles incorrectly is about where you are in the hierarchy and things like that. Unexplained gaps are not good on CVs. Usually the recruiting people want a Word CV. So if I was ever going to send a CV, I would send both. I would send a Word and a PDF, for the simple reason that sometimes they have to format it before they send it for shortlisting. And if it is sent as a PDF, it cannot be formatted by the HR. So it is important that you must send both the Word and the PDF document of your CV. Very important. Okay. Don't just send it as PDF. It's not good. Poor filing name. So which means you have saved your CV. Most of us save our CV as, like my CV is saved as AZK main CV. Okay. Some people save it as, some funny name you put onto it, which doesn't make sense. So don't be very careful about how you're saving your CV, because that's the first thing that I will see when I'm clicking on the computer. The first thing I see is how have you saved your CV? What is the name you've put in? So the best thing is put your name and CV, and always underscores. So AZK underscore CV, that's good enough. That will represent you. Wasting space is a common thing that I see on CVs, and lies. Oh my God. Oh my God. It takes me less than 10 seconds to sniff out a lie on a CV. Do not exaggerate. Do not lie. If you have not done something, you have not done something. Don't try to write things on a CV which you have not done. And I can very easily dig it out. Very, very, very easy. It takes me very little time to find. And the moment I find one lie on your CV, there is no hope in hell you will ever get the job. No hope. If I find that you've lied even once, there is no. I want you to be truthful to tell me that I have not done it. That's okay with me. If you've not done it, we can deal with it. But if you lie to me, no way you will get a job with me. Very, very clear cut. So do not put lies in your CV. Okay, very important. All right. Spelling mistakes. Look at that. I specifically made the mistake to show you. The one thing which will just destroy your CV is if there is a red line underneath. You know what's a red line on Word document? When you type things, if there is a red line under any of the word, it means it's not been spelled correctly. It's okay to have an American spelling or a British spelling. That doesn't matter. We are not. An esophagus can be spelled with an O, or an esophagus can be spelled with an E. That's not an issue with us. But if you made a spelling mistake, it tells me that you're not careful enough with your CV. And you'll be surprised the number of times I get CVs with spelling mistakes, like I've shown you in front of you, okay, on the slide. So, and many times in international conferences, you have speakers who put up slides and they are spelling mistakes. It's a huge, huge no-no, okay, huge no-no. So spelling mistakes are not permitted on CV. So do not. One spelling mistake and you're out of the door. I promise you that. So it's that, because it's a competitive world. I've got 200 other people. Why should I bother with somebody who makes a spelling mistake? Okay. Grammatical errors. On a Word document, if you've got green line underneath your statement, it is grammatically incorrect. Nowadays, there is a lot of apps available, Grammarly and those sort of apps. They can correct your grammar for you. Okay, so do not have grammatical errors in your CVs. They are not accepted. So grammatical errors we do not like, and we don't entertain them on CVs. Wrong tabs. Now this is something that you need to understand. Okay, for this I need to show you a CV. Okay, I'm going to stop sharing this. Okay, are you still with me?
Yes, sir. Yes, sir.
Okay, I am going to share my desktop with you. I want to show you how we let me share my desktop. Okay, can you see my desktop, my whole desktop?
Yes, sir.
Yes, sir.
Okay, so I'm going to bring up a CV to show you. It's my CV somewhere. Can you see my CV?
Yeah.
Okay, now see the CV and everything is lined in a particular way. Can you see that? A lot of you use the space bar to line it in a particular way. So all I do is I go onto this and I do this. The moment I do this, okay, can you see what I've pressed? This button here? The moment I do this, this clearly tells me if I do a space, there will be dots there. Can you see that? Yes or no?
Yeah. Yes, sir.
Yeah. So if I want to space it, if I use tabs, that's no good. If I use space bar, that's not good. The way to space it is to use tabs. Can you see that?
Yes, sir.
And I can clearly, the number of times I see CVs who have used space bars to tab it. So whenever I'm shortlisting somebody and you send me a CV in Word document, all I do is I go and do this. The moment I do this, and if your spacing is showing me this, I know this guy doesn't know Microsoft Word. Okay? Did you understand what I said? See, whenever
Yes.
you use a space bar, there will be a dot which turns up. Whenever you use a tab, you get an arrow. So if I see space bars, no good. It means you do not know Microsoft Word. You do not know how to make a CV. Okay? So never, ever, ever space it using space bars. You always have to space it using tabs. See this tab? You tab it and it comes quite well. Yeah? Can you understand that? Again,
Yes,
the
sir.
other point I wanted to make about page break, okay? So see this, if I type anything else here, okay, my next page has stayed the same. It has not moved. Can you see that?
Yes, sir.
And the reason it has not moved is because always, whenever I want to put it, there is a page break. Can you see this? And how you do the page break is you go there, insert, page break, go to break and go to page break. So in my CV, I have inserted, gone to the next page by inserting a page break. Can you see this page break? So no
Yes,
matter
sir.
how much more I type here, yeah, see my next page is still the same. Can you see that? Did you understand that or no?
Yes, sir.
So this is what I meant by page break, that you should not go to the next page using space bars or return arrows. It must be page break. So when you insert a page break, I can see that you've inserted. See, now it's gone. But if I put this back in, I know this is a page. So no matter how much more I write here, I want to edit my CV, I can write on this page, my next page remains the same. It does not move down. Did you understand that? And see, the next page is still the same. So my research profile is still there. My educational profile is still there. And these awards and grants are still there. So I've written 3 extra lines, but not moved the rest of the CV. You understand that? So that is very important. This how to do a CV is absolutely vital. Okay, and it is very important to understand Word. Okay, let me get back to this. Okay, so I need to share with you guys, right? So let me just get back to share screen. I want to share screen. PowerPoint. Sorry, just 1 second. Okay, can you see the PowerPoint now? Can you see
Yes,
the
sir.
PowerPoint, guys?
Yes, sir.
Yeah? Okay. So this is what I mean by tabs. Okay, you must not use the space bar, but you must use the tabs, and you must insert page break between 2 pages. Okay, you must never let it run over onto the next page, because when you add things on 1 page, the next page then gets disturbed if you've not put in a space bar, if you've not put in a page break. Did you understand that concept or not? You'll have to fiddle with
Yes,
words.
Yes, sir.
Okay, capitals. This is another, this is my bugbear. Now, if you guys are young people, you guys interact on social media a lot. And do you know that when you put capitals in a social media text, you are actually shouting? That is the connotation. So why would you put all capitals in a CV? I get very annoyed when people put all things in capitals. Like, I am the best cardiac surgeon in India, and everything in capital. I mean, really? And you write it all in capital. Or I have published the first, I'm the first DNB student of this country, and you write it all in capital. You think you're trying to impress me by putting it in capitals, but capitals always mean shouting. Capital always comes at the start of a paragraph or start of a sentence. Nowhere else does it come in capital. So you must be very careful about how you use capitals on a CV. Okay, very, very important. Never write things in capitals. Except the heading, you should not write anything else in capitals. Okay, very important. Font size. You must maintain a single font and a single size throughout the CV as far as possible. You can capitalize the headings, but the rest of the stuff must be same font, same size. A good one is Times Roman, okay, Times New Roman or Arial. Okay, these are standard ones which we like. If it's an inconsistent font, one font is something and another font is something, no good. I don't want to see this CV. If it is one fancy font, you know, Comic Sans relief and all that, those fancy italicized and all, I don't want to see that CV. I want a simple Times New Roman size 12. Okay, size 12 is all I want to see on the CV. A simple Times New Roman size 12. That is the standard acceptable. 10 or 12 is okay. Those are acceptable sizes. Don't go 14, 16, 18. Not good. Okay. Now, whenever you write out your CV, you must start with the basic information. So the CV must have basic information. You have to write your vision statement, and I'll take you through my CV in a bit. You must, this is very important. People don't understand what is a vision or mission. This is career aims. Even if you write your career aims, we are okay with that. If you can use the word career aims, that's okay. In my CV, I write promoting healthcare through education and innovation. That is my mission statement. Okay, promoting healthcare through education and innovation. That is what drives me to do whatever I do. So your vision and mission statement has to be very clear in your CV. You can write it as a career aim. I don't mind that. Always have a header in a CV because header and a footer is very important. On a header, your name and the latest month should be there. So do you know what's a header and a footer? So, you know, there is matter in the middle, and on the top, there is something which is consistent on all pages. So again, I might have to just go out of here and show you my CV to show you what's a header and a footer. Sorry about this, but it's important you understand what I'm trying to say. Where is my CV? Okay, can you see my CV? Yeah, see, this is called as a header. This is a header. Now I've clicked on it, that has become, can you see this header? So the header, every page if you go into a CV and every page should have a header and a footer. The footer is usually the page number, and the header is usually your name and the month when you made the CV. So I know that this is an up-to-date CV. You understand that? And when you come back here, that goes away. So your CV must always have a header and a footer. The reason why is because we are seeing 200 CVs. We forget whose CV am I seeing, because there's so much I'm seeing. So every page that I turn, my name must flash out to the guy. My name must flash out to the guy. This is the guy. He has done all these, whatever this education profile is his. The research profile is Dr. Khan's. Okay. Oh, these are his international affiliations. You understand that? So instead of writing my name in each of these things, I put a header on the top. So the header remains constant and the footer changes. The footer is always the page number. So the page number then comes out, and then you can. So now I've written this. Now he knows that these are the operations performed by Dr. Khan. Okay. These are the operations performed by Dr. Khan. Again, he comes to the next page. Oh, these are the operations performed by Dr. Khan. So it is very important to have a header and a footer in a CV. It is absolutely mandatory. I'll just share my desktop like this. Are you okay, guys? Can you see my?
Yes, sir.
So header and a footer is quite important. Okay, it is important to have a header and footer. The chronology of experience is very important. The chronology should always be from recent to backwards. Always the most recent first. Don't tell me about SSC, HSC, MBBS in that order. It is never like that. It's always recent to backwards. And don't put in SSC and HSC. I'm not interested. I want to go up to your MBBS. That's all. So MCH, MD, MCH, MS, MBBS. That's it. You don't need to put SSC, HSC. If you've done some research degree, you put the MSc. It's okay. But don't put which school you went to or which high school you went to. I'm not interested. Just take all of that away. Okay. Don't put a Mahabharata. I really hate it when people write lots and lots and lots of things. That is not just point wise. Everything should be point wise, bullet points. Okay. Prizes and awards are very important. As I showed you in the shortlisting, there are 3 points that you can get for prizes and awards. Don't underestimate yourself. Please put your prizes and awards. Very, very, very important. Okay. You get points for all the prizes that you've won. Operative logbook is mandatory in a CV. You must put a synopsis of your operative practice. At your level, you must put performed assisted, and assisted. At my level, it is all performed. So I'm not worried about assisted. Okay. So always make sure performed independent, performed assisted, and assisted. So you must have a 1-page snapshot of all the work that you have done. I don't need to see your 6 years logbook, but in your CV, I want to see a snapshot of the kind of operations that you have done or you can do. Okay. Memberships are important. We spoke about it. Of memberships of professional bodies are quite important. Courses attended are you must have some, not just cardiac surgery courses or thoracic surgery courses. You must have IT courses. You must have self-development courses. You must have a wide variety of things. You must have ATLS. You must have ACLS, BCLS. The one thing that we look for in CVs is statutory and mandatory courses. Whenever we appoint somebody to a job, we want to make sure that he follows all the guidelines. So statutory and mandatory courses are important, and a lot of people forget about them. And these are the statutory and mandatory courses that are required in the UK. So deep vein thrombosis, conflict resolution, end of life care, equality and diversity, fire and safety, health and safety, infection prevention, information governance, very important. IT courses are very important. Moving and handling patients, and basic life support and risk management, very important. But in the UK, we also want to have safeguarding children and safeguarding adults, which means you're not a pedophile. Okay, we want to make sure if you're going to be working with children, you are safe for the children. So you should have done these courses. We need to make sure that you have no issues with working with children. So this is my chart, which I have got. I showed it to you, that I have done all the courses, and there's the date, there's the expiry date. And whenever I have to renew the courses, it will come up automatically. Okay. Before you apply, make sure within your own country, you do what is called as a disclosure and barring services, DBS it's called as. DBS is like a police record, okay? So when you're applying internationally, you need to actually have a DBS with you, a police certificate saying you do not have any cases against you. Look here, police record, no recorded, no problems, no citations, no convictions. This is, so it's quite important, this page 1 and page 2. So it is important to have a DBS with you when you're applying internationally, because we are going to ask you, do you have any police record? Or do you, because are you safe to work with children? We want to know that. So you must have some sort of a certificate to show that you are DBS certified, okay? Research experience is very important. Don't forget to write research experience. We very highly value research experience, and I'll show you my CV in a minute to understand how to write about research experience. Audit is mandatory. I want you to write audit. You have to cover audit. If you have not done one, please do one. It has to reflect in your CV. Management experience is highly, highly rated. As I showed you in the points, we do want you to write management experience. You know, it could be simple things like managing an operating list. It could be things like managing a post-operative care or an ICU or whatever. You know, put management experience. We are all doing management every day. It could mean, it could be a educational program that you manage, anything. Or you could have been a secretary of a club. All of that is management experience. Teaching experience is vital. You must put in teaching experience. Again, I'm going to share my CV with you to show you how to do that. Presentations have very high points, and there is a way you write your presentations and publications. You'll be surprised. This is how it should be written. Your name first, then the paper, and the journal has to be mentioned. Or you can do it like this. There are two ways. There are two ways which you can do it. One is the publication with the author, with the journal written below. We must know the journal below. If it's a presentation, we must know where you presented and what was the date of presentation. So this is how you have to write a reference, okay? It's very important. Publications have to be mentioned in this way, because I might want to check whether you've actually published or not. And the way I check is I copy paste this into the Google, and I can see if this paper has actually been published or not, or are you faking it? So very important to write it. This is an international way of writing papers and publications. Always avoid these words. For God's sake, don't use these. I have seen this first reported case in my state, first reported case in literature, India's only case report of, it's just so annoying. When I see this, it just irritates me and I throw it into the bin. Do not use expletive words. Always stay in moderation. Always say, I have good experience in so-and-so. I'm not the best. You must not write, I'm the best thoracic surgeon. I know I'm the... Please avoid expletives, okay? Avoid these very excellent words. Just be modest, be humble, and stay within the domains, okay? Referees, very, 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 very important. We do not see references before the shortlisting, but we will not give you a job until and unless we read your references. And I told you there are two reasons why people write references. One is because you're really good, or number two, they want to get rid of you. If they want to get rid of you, it's a very easy way to pick up what's on the reference. So we are very, very clear about that. So thank you very much. And I want to actually finish this by showing you my CV. So are you still with me, guys?
Yes, sir.
Yes, sir.
Okay.
Yes,
So I'll
sir.
just take you through. Mine is a bit long because obviously I've got years of experience. So my first page shows, can you see this? Can you see this? Yes or no?
Yes, sir.
So my first page is talking about my attachments and things like that, talking about whatever else I do. But look at this one. This is important. Can you see the last line there? The mission statement. So you can write career aims. I don't mind. Use the word career aims. But you have to write very clearly, what are you achieving in life? Why should I apply? Why should I, why should I employ you? So look at my specialty interest. I can put all of this. Everything that you're doing online, everything is your specialty interest. Then see, the page break is coming into picture. So now I go to my next page. There's a little bit of my personal details. Now here you don't need to write whether you're married or I've seen CVs which write son of Mr. Suresh Joshi, married, wife's name is Sudha, 2 children. I don't need to know all that. All I need to know is what's your nationality. That's it. Just nationality is all I need to know. Your name, date of birth, and nationality. That is all that I need. And most important is I want a Gmail. I want a email. Most important. So this is a short introduction and medical counsel. Okay, medical counsel is mandatory. So if you've got any medical counsel registration, you must put the number in there. And if you've got an NOC from there, just put it that NOC received, no, whatever, So you can do that. Now look at qualification, just put a small synopsis and always from recent to backwards. So start with the recent and go backwards. Previous appointments from recent to backwards, okay? And you don't need a whole lot, just 1 or 2 lines about each one. We're not interested in previous appointments. We're more interested in the current appointment, okay? Prizes and awards, just put the prizes and awards in a synopsis, in a line. Research grants that you have done, just put that. Now, this is my CV for some other purpose. So this is, I put my educational and teaching profile right at the start, all the things that I'm doing. And see, it's not a paragraph, it is all points. Every single one of this is a point, just point wise. A, 1, 2, 3, 1, 2, 3, okay? So everything is a point. Research profile, these are just all the research things that we are doing, stuff like that, whatever research you've done, it's very important. This matters a lot. Affiliations, at my level, you have a lot more international affiliations. At your level, you may not have as many. So just put national or local affiliations. It's fine, that's all right. Now, operations performed, I put all my operations performed because obviously I'm at a higher level than you guys, but see how well I've arranged it. See, robotic surgery is separate, VATS is separate, 3-port VATS is separate, whatever uniport I do is separate, local anesthesia is separate, open surgery is separate, open pleural surgery is separate, mediastinal esophageal surgery is separate, chest wall is separate, diaphragm. So this I have to put this because I'm at a very senior level. You don't need to put so much detail, but just you must be able to show me that you can do the basic operations in thoracic or cardiac surgery. Now, this is my cardiac surgery synopsis. If you're a cardiac surgeon, this is all you need to put. These are all stuff that I have done. I have operated. It is there. Okay. You don't need to, at your level, you might have to put how many you have assisted, how many you have performed. At my level, I've done all of these and I've got a proper logbook which tells all the numbers. So I don't have to worry about it. Now, chapters published and all the things. See, papers have to be very clearly, this is the way it has to be organized. Can you see this? It has to be properly organized. Here is the name of the paper. Here are the authors and here is the journal. Anybody wants to see this paper, he has to just copy paste this and he can immediately bring up the paper. So at my level, we have not more. I've got 100, 200 papers. So that's different. You may not have that many. So you don't have to do that many. And then faculty at conferences or teaching experience, whatever you've done is okay. Posters presented, or papers presented, international papers presented. So I have taken out all my local papers. I've kept only international papers. And unfortunately or fortunately, I have a lot. So my CV goes on a lot more than CME's courses and conferences attended. Again, on a separate page. So everything moves to a separate page. So when you go through my CV, everything is very, very well tabulated. Cardiac surgery courses that I've done, echocardiography courses I've done, general surgery courses, research methodology courses I've done. It's all well tabulated. IT courses you have to put. And in the end, when you put your references, don't forget to put an email for your referee and a phone number for your referee, because we will actually email and we will phone your referee to find out what you need to find out about you. Okay. All right, let me stop share and let me stop recording. I'm sorry it went on too long, but it was a lecture worth attending for you guys to understand how we make a CV and how you get shortlisted. I'm happy to take questions because it is a lot of things to take on board. Yeah, there's some private conversations. I will write to you. Dr. Lamar, I'll write to you separately. Just, I got your email, thanks. Anybody's got any more questions to ask me? Guys, go ahead and ask. It's okay. This is the time to discuss.
Hello, sir.
Yeah, hi. Just 1 second.
Can
First, identify who's speaking, and then.
Sir, I'm
Because
Dr.
I
Ajay.
can't
I'm
see.
Dr. Hello.
Yeah, hi, Dr. Ajay. How are you?
I'm Dr. Ajay from New Delhi, sir.
Yeah, hi, Dr. Ajay. Tell me.
Sir, I just wanted to ask one thing. When we are applying for a fellowship, for an international fellowship, say in UK, we have to get our GMC registration done beforehand before we
No.
apply.
No. In UK, for you to, if you have a job, then you will get a GMC registration. It's the other way around. We do not. If you have a GMC registration, that's great. We are very happy. It takes the hassle away for us. But we do offer jobs to people. If we have a position, we offer jobs to people, and then using our offer letter, then the hospital applies, the HR applies for your GMC. So it is the other way around. Once you have a visa and an offer letter, then the GMC automatically gives you the job.
Okay. I can comment on that, Zamir.
Hi, Kamran, how are you? Come in.
I missed your talk. I was operating, just finished now. I think this is a very fantastic talk because everything starts with the CV. This is where you sell your wares. It's like a marketplace. You have to attract attention and put your unique selling points. Very, very important. In terms of the question from your colleague, generally the regulations in the UK are that you need to have. I do a lot of shortlisting, interviewing for all sorts of posts, and we get sometimes hundreds of applications, and of those, sometimes 80% of them don't have GMC registration. They may be amazing qualified candidates, but if they don't have the GMC registration, you can't offer them a job. You could maybe consider them, but then that's with the proviso. It may take them up to 6 months or a year to get the GMC registration. So up front, if you get the GMC registration, that puts you already in a favorable category because you are potentially shortlistable. If you don't have GMC, no matter how excellent CV you have and qualifications in the UK system, unfortunately, it's unlikely they'll shortlist you.
Yeah, but having said that, nowadays with the new schemes coming out with the GMC, medical training initiatives and all that, the MTI has come in, and we have had instances where we have actually picked up people, and we as a trust have sponsored their visa, but it is a much longer process. So, like as Kamran said, if you've already got the GMC, we are very happy. We're very happy, but there are certain positions where I have been personally involved where the candidate did not have a GMC and they got the GMC on the basis of the job that we offered them. But for that, you need a really good referee at the other end who is willing to do the things for you or to push you along. So don't get disheartened if you don't have a GMC. The chances of not getting shortlisted are higher if you don't have a GMC. But there are a few positions where we are actually, like we just did a fellow for robotic surgery who did not have a GMC, and we got him in and we got the GMC for him. We got the visa and then we got the GMC. So it depends on how badly we need you. If we need you, then we'll do everything for you. But if we don't need you, then we will put you in the bin. So it's better to have a GMC. If you've done your MRCS and you can get a GMC, very happy with that. Much more easier to shortlist.
Sir, one more question. May I ask one more question, sir?
Yeah, please go ahead.
Sir, Ajay, sir, with our degrees, like with in Indian systems, sir, you are aware, like having MS and MCH, do we? Is it easy for us to get a GMC registration without a job in our hand, a fellowship with their?
There is no way you will get a GMC on the basis of Indian degree. The answer is no, straight away. Yes, you will not get a GMC registration on the basis of Indian degrees. So for that, you have had to have either passed PLAB, or you have had to have done MRCS, or the hospital has to be ready to sponsor you. The Royal College has the scheme called as MTI, so Medical Training Initiative, where we can give you a visa for 2 years, where the sponsor will sponsor, the hospital will sponsor you for the visa, And so when you get the job and the visa, then you go to the GMC, and then the GMC. It's a very roundabout way of doing things. So the reason why I'm saying this is I don't want you to be discouraged from applying. I want you to start applying because you don't know when there will be a vacancy where they do not have enough candidates. You don't know that.
Can I comment there?
Yeah, come in, Kamran. Yeah, please do.
In the UK, there's been big changes in recruitment in workforce. Traditionally, cardiac surgery used to be very competitive, very difficult to get into. In the era when Zamir was coming in, even to get an SHO job, you'd send 30, 40 applications, and you wouldn't get short. I was the same. I applied for many SHO jobs, wouldn't get, and I was a UK medical graduate, and it was very challenging. Then, over a number of years, then it became very unpopular, and so there was a big shortage, and most of that shortage initially was filled by Europeans. Many Europeans came, and they had the qualifications. And currently, with the Brexit, I think there's probably less Europeans coming now. So there is going to be a demand. And so if you have opportunity, St. Thomas's, Zamir knows very well, these hospitals used to be very difficult to get into. We couldn't recruit. So we've now appointed some colleagues. One of them is from India, Bombay. We've appointed someone else, Egypt. So there are plenty of opportunities for international medical graduates. If you have the paperwork, there are very good opportunities in all the hospitals. And what Zamir mentioned is the medical training initiative. The Royal College of Surgeons, they have the international training program. And so you can apply via them, and they can do a lot of things in terms of sponsoring you. They can try to allocate you with a training position where you'll get some training. And so there are things. Another way of getting into GMC registration is via the FRCS intercollegiate exam, as well as MRCS, the FRCS. So many candidates now who are experienced, who have done MCH or done other exams, are doing that route, because once you have that, that's better than doing cloud, it's better than MRCS. That's your specialty. It'll give you a very good qualification. So if you do come to the UK, you'll be taken much more seriously. And doing the FRCS exam, the other advantage it gives you, it tells you how the UK system, how you think, how you assess patients, how you consent patients, all of that. If you have that to start with, it will put you in a very strong position.
So that is why I was saying that don't get discouraged by the difficulty in getting a job. Actually, you never know. So I that's why I sort of Kamran made the point, and I countered that point because I don't want you to be discouraged from applying. I actually want you to apply. The biggest mistake that everybody makes is not putting in an application. I'll tell you the number of times in my own unit, we had a job and my trainee from India did not put in an application. If he has not put in an application, how the hell can I push him to get a job? You understand that? So it is very important that you apply for the job. And then you never know how things work out. You never know how these things. The application is the first thing. You must apply. Do not get discouraged by all these things. There are a lot of legal issues. It's easy to discard a CV. So if you don't have a GMC registration, I might discard your CV. But if you've got a lot of experience, I'll keep it to one side. And then I'll wait for the rest of the 100 to finish. Once I've finished, and if I find that I don't have good enough candidates, I might actually pick you up back again and say, okay, let's see if we can work with this. Let's see if I can convince the HR to sponsor this guy. So there are people like me and others around who are willing to encourage foreign graduates. Kamran is very, very supportive of foreign graduates. And we want to encourage you guys to come and train with us. So that is why I'm saying, do not get discouraged. You must.
Can I make another
point?
Come in.
Please do. Kamran, come in.
One more point. So basically, the application is everyone should apply. And Zamir talked today, I missed the talk, but on the CV. Now, any job that, if you apply to the UK for any position, it comes via a system called the NHS Jobs. And the application form is very standard. It's a generic application form. It can be for any job, whichever specialty, has the same headings as the personal details, as your previous appointments. It has sections which basically are used for the shortlisting. Every application form will have a section on your experience, clinical experience. They'll have a section on your teaching, and they have a section on your research. They have a section on management, a section on audit, and then there's always a blank area. It says up to 500 words. tell us about any other further information. Many people who are very qualified, unfortunately, the form needs to be filled out just like you do for the CV. You need to fill it out a lot of detail, and you need to make sure within every domain that you have something to show, because some people they may leave out the audit, they may leave out management, they may leave out further commitment. Just by doing that form nicely, there's a lot of value that can be done. That's where the shortlist, you shortlist based on the application form. The CV often isn't sent when you apply for these jobs. It's purely based on that NHS jobs form. And people can look at you can go online, you can look at NHS, look at any job, look at a sample form, and just practice and show people. You can show it to Zamir, show it to other people, just to get their take. Is this going to be competitive? And many times it's just even the way the form is written, some of the language, all these things you can get some advice and coaching on.
Yeah, I went into great detail, Kamran, on the shortlisting. So I showed them every single section and how we go from 0 to 3. And I did the ST1 shortlisting format, and I showed them everything in great detail. So they've understood that if they leave something blank, they will lose marks. So that is the key to it, that you should not leave anything blank.
Yes.
Sir, one question I wanted to ask.
Yeah, who is it? You have to first identify yourself.
Yeah, this is Dipendra, sir, from Lucknow.
Yeah, hi, Dipendra.
Hi, sir. Sir, I wanted to know about the preparation, how we can go for a FRCS preparation, because I am searching online. I am not getting the exactly, which kind of content I have to study. It's very confusing, sir.
This whole program of Thoracic Gurus has been dealing with it for the last 1 year for preparation for FRCS. You probably need to get in touch with one of us.
Sir, this is the first time I am on this forum.
Yeah, so you need to get onto this Thoracic Gurus group, and we are discussing this every day, almost non-stop, to be honest. So get on, send us your number, and we'll put you on the group. And
sir,
we'll give you good information.
Yes, sir, I will just write it here. 860.
Sorry, I can't write just now, but send it to me.
Yeah, sure, I will, sir, send.
We'll try and help you. Okay.
I'll put my email as well. Anyone can contact me. I'm very happy.
Thank you, sir, so much. I appreciate it. Thank you.
Wait a minute. My email I'll put on the chat. Anyone want advice about any jobs, anything I can put, I'm happy to advise them about the system. I'll just write it here.
So.
Yeah, next question. Anybody has got any other questions to ask? Let me go through these things. What is this?
Sir, one more question, sir.
1 minute, just wait, Dipendra. So
yeah.
SPSS, FCPS, yeah, all of this is important. You need to put that in. SPSS is very highly rated as a course. If you've done a course on it, that's very good. Is there a preference for MCH about DNB, CTVS? The answer is no. Internationally, it doesn't really matter. It's a postgraduate degree. So internationally, whether you've done MCH or DNB, CTVS, it doesn't matter. We will consider it as a postgraduate degree in cardiothoracic surgery. So there is no preference of MCH over DNB. Okay, and can a DNB student with integrated 6-year course prevail for fellowship in UK? Definitely, that's what we are talking about. It's exactly what we are talking about. Is it compulsory to clear MRCS for applying? Not necessary. Not necessary. I know of a few candidates who have not done MRCS and who applied and have got a job in the UK. So not necessary. See, the UK is like this. If they need you, there are no rules. If they don't need you, there are 2,000 rules. Okay, that's the reality. So if they need you, we can bend every single rule of the book. So, but the bottom line is, if you don't apply, you are not in the game. So, Sachin Tendulkar has to be on the pitch to score 100. You cannot score 100 sitting in the living room watching TV. So you have to put in an application first. Most important. Kamran has put his details there. Everybody, please quickly copy that. Take a sample and copy that. If you want, I'll copy it and I'll post it on our group as well. Let me just copy that 1 second. I'll put Kamran. Kamran, is it okay with you if I share your details on the group for everybody?
I'm happy. Yeah.
Yeah, thank you. Okay, so something else. In the NHS job website, it's always written in the end, GMC registration is mandatory. That is correct. GMC registration is mandatory, but you apply till you get some sort of GMC. You must make the application. Don't worry about it. Just put the application in. Okay. You never know. There might be no applicants for the job, and you might be the only applicant. So we will take you, and we will do the GMC for you. But normally, GMC registration is mandatory. That is correct. But there, as I said, if you need a candidate, there are ways to do things. Okay. So remember that. That's what I'm trying to say. Doing monthly departmental audit can be mentioned. It's not about we did 7 cases of CABG this month and 12 cases of CABG that month. That is not audit. That is not audit. That is accounts. Audit is a proper process, and you need to read about an audit process. You have to ask a question. You have got to do the whole cycle of the audit, and then you got to finish off with re-auditing the whole thing. So don't that monthly audit which you do is accounting.
We
you know,
should
25 CABGs we did and 7 lobectomies and 8 things. That is not audit.
for the audit. Just to say, Zamir, we should. You know, I think audit. We should maybe do a talk one day. I think just because the audit specific to NHS is very different to what people may imagine, because it has to be a process. You can audit many things. You can audit outcomes process. And so we can give some examples. And one of the best people to do is our colleague Oscar Nawaz, because he applied for ST3 5-6 times. And so he did many audits in the process, and then eventually he got his ST3, and now he's a thoracic surgeon. So we'll get someone to give examples of audits. All these things can be done internationally. Similar.
Or you will be the best guy as well, Kamran, to give an audit talk.
I can do, because I've supervised many audits, but it's.
I mean, Asghar or you, I'll speak to both of you, and we'll try and get something done. So is IELTS compulsory? Yes. Yes. That is a requirement for the GMC. 7 or 7.5. I don't remember what is the new number, but IELTS is compulsory. You cannot get GMC registration without IELTS. The Europeans could get GMC without IELTS, but overseas, beyond the EC, you cannot get IELTS. You cannot get GMC without IELTS. So it is mandatory. It doesn't matter whether English medical school or not. IELTS is mandatory. It's a legal requirement. For anybody outside the EU, in fact, now even the EU will have to get IELTS. Okay? All right, guys. Thank you very much. We've been going on for 2.5 hours. I hope this talk was helpful. Anybody's got any final words to say? I stopped recording, so we are okay.
Thank you so much, sir.